the level of neurodegenerative disease in Africa is rising very fast. We need to improve the training of our specialists. Different levels of achievement in different countries, where some countries are so far ahead in neuroscientific education and training and research compared to our region. That basically helped us understand what role the EAJNS can play in improving education, research, and training.
Hello and welcome to episode 1 of the EAJNS podcast, where we bring conversations from authors who are shaping neuroscience research in Africa and beyond. I'm Riya Patel, and today I will be in conversation with Dr. Faisal Nageyle, a medical doctor, managing editor of the EAJNS, and author of a very interesting article. Today, we're going to explore key motivations behind their work, key findings, and its implication in neuroscience across our region. Thank you for joining us. Dr. Faisal, before we dive into your paper, tell us more about yourself and what drew you into research and neuroscience.
Yes, thank you very much, Ria. So, I'm a graduating student of the University of Nairobi with MBCHP in just a few days. And I started conducting research in my third year of medical school, where we had a really, really long break. And I was lucky to meet a good mentor who involved me in neurosurgical research, just from basically an interest in neurosurgery as a specialty in medicine. And over a period of time, we've published a few papers and being trained more in conducting research. Then I became an intern at the EAJNS, the East African Journal of Neurologic Sciences, where I stayed as an intern for a period of 1 year, became an editorial intern for a period of 1 year, then now acting as the managing editor at the EAJNS. And having interacted with so much research from most of Africa now, Kenyan research, East African research, and the rest of Africa now slowly becoming a global institution, I have slowly developed more and more interest in neuroscience.
So you also serve as the managing editor for the EAJNS, and you'll soon be a practicing doctor. How do you think these roles will intersect in your clinical practice?
Okay, so going back to just first of all how we did this research and this neuroscientific research from the perspective of a student, it allowed me to understand what the field looks like in Africa, basically what gaps there are, what place I can take in developing neuroscience in Africa. Then as I slowly grew into more of a doctor now, you understand what the important role of information, especially properly reviewed, peer-reviewed scientific information is in making medical decisions. So ensuring that I have access to the best medical information, to the best information that applies, first of all, to my population of Africans who have different characteristics from most of the rest of the world, that would help me make better decisions for my patients.
Yeah. Let's talk about your article, The Status of Neuroscience in East Africa. What inspired your research question?
So this paper, we started it while I was an intern at the EAJNS, and it was just a question of what does neuroscience look like. We are trying to publish more research from East Africa, and we did not have enough information on what fields and what work people are doing. So we decided to take a snapshot of the published articles and the work that had been done by other Africans in 2020, by 2024 actually. So we had very interesting findings where we identified many challenges. We saw different levels of achievement in different countries, where some countries are so far ahead in neuroscientific education and training and research compared to our region, and that basically helped us understand what role the EAJNS can play in improving education, research, and training.
So let's talk about your article, Status of Neuroscience in East Africa. What inspired your research question?
This paper we started doing the research for this paper when I was an intern at the EAJNS, and the aim of the paper at that time was to identify the amount of research that is being produced by East Africans and generally in Africa in general, and also to understand the level of training and education in different neuroscientific fields such as neurosurgery, psychiatry, and in this case, we wanted to identify where most of our trainees were coming from, where this education was being provided, and where these doctors or scientists were practicing eventually. We were also trying to see how does our region compare in research production in relation to the other regions, such as the South African region or the North African countries. And through this process, we found that there are many limitations to neuroscientific education and research in East Africa and Africa in general. And these problems can be solved by more collaboration and more intentional development of institutions.
So you speak about collaboration. What do you think is the most ideal collaboration? Which are the most ideal partners to collaborate with to solve this issue?
So through our paper, we identified that most neuroscientific publications, depending on which field you're looking to, but most neuroscientific publications are coming from countries like South Africa, followed by Egypt, then a few West African countries, and we find that Kenya is number 8 in that list, and it's actually the only East African country that appears on the list of highest producers of neuroscientific research. And you will find that the amount of research that comes from Kenya now is just 2% of the annual of the publications in neuroscience by 2016. So the one collaboration, for instance, in research can be if we tried conducting more research with other countries in Africa and observing, first of all, how do they do their research, how do they fund their research, and what type of research do they do, what type of research training do their neuroscientists receive in those countries, and try and adopt those methods in our country, because generally the populations are similar, apart from the geographical disparities. In that case, the other collaboration that can be done is communication, providing a platform for neuroscientists in Africa to exchange information more freely, to exchange information without having a significant cost that comes with publishing research in these very big journals, which most of us in Africa cannot afford to publish in and to read from. So that all that kind of falls into the objectives of the East African Journal of Neurologic Sciences, and we have attempted to do that over the last 4 years.
So which gaps in literature were you trying to fill with this study?
Okay, so before we developed an approach, before we did anything in relation to neuroscientific research as the EAJNS, first we needed to know where are we. So the first question was how much research is produced in Africa, and as I said, most of it comes from South Africa and North Africa, with little research coming from East Africa and just Kenya. That's one. The second thing is, fine, there is research. What are the problems with that research? And we found that majority of the limitations of research come from the financial and labor perspective, in that there is limited financing of research in Africa. So what you'll find is that up to 50% of research, actually up to 70% of research conducted in Africa in neuroscience is financed by an external source, by a non-African funder, and that means the product of that research will be more used or will be more useful to the people who funded that research to their aims. Okay, so with only 30% of research being funded by us as Africans, and up to most of those self-funded research being in South Africa, we find that that is a big limitation in research. The other thing we found is other than financing of the research itself, we have limited access to tools that these researchers can use. So we don't have well-developed laboratories, we have limited access to technologies, we have limited access to patient data and research data, because you will find that most of our data is in analog format. And that, first of all, cannot be used easily in people who are not in the same place, and it cannot be shared more easily. The third thing we found was that there's a limitation in the training of researchers, and it has improved. We have more neuroscientists in Africa, we have more neurologists, we have more neurosurgeons than we used to have, but that number is not keeping up with the population that exists in Africa. Our population is growing. We have a large number of younger people, and even a larger number of the elderly now that come up, and you find that, first of all, for the younger people, you have higher rates of traumatic brain injuries, and we haven't really developed institutions to manage those conditions to a level where we can ensure that the patient has the best outcome. For our elderly, we don't have a lot of trainees in basically people who are specializing in neurodegenerative disease, and the level of neurodegenerative disease in Africa is rising very fast. So with that, we need to improve the training of our specialists.
So what are some of the logistical challenges that stood out to you during this study?
So what we found is that we have limited sharing of information among Africans. So that can arise from, first of all, we have different languages. When we come to publishing, we have the Francophone Africa, then we have the English Africa, where we can't really share information more freely due to that big wall of language that exists. Even when authors submit articles to us at the EAJNS, we find that we need to have someone who is speaking French look at that study and ensure that the data from that study is accurate. What you find that many African scientists are really trying to look for a platform to publish their work, and they have to cross language barriers to publish such work. So there is a limitation in the sharing of that information. The other thing that comes, even in our own region, we don't really share research across our own borders, and that could be there could be a lot of reasons for that. But fortunately, nowadays we have institutions and organizations like EANS, PANS, that are trying to bridge that gap to help us communicate better and share information and interact more. The other thing we found is we had limited access to African. Again, as I said, most of the published works, especially published in high impact journals, is behind a giant paywall that most of us can't access. And most of that research was funded by an external source. So we produce the research and we can't access it without going into a lot of financial constraints. So if we have a system where we can publish our own research at a journal that is dependable and efficient and is accessible to anyone from Africa and especially East Africa, that would help us communicate and share information better.
So that's where the EAJNS comes in. Yeah. Our region faces unique resource challenges. So how does your study navigate these?
Okay, what we from our study, we aim to identify what these resource challenges are. So first of all, when it comes to the aspect of labor, we already said that we had limited output when it comes to trainees. The problem comes up now is we also have limited retention of those trainees. We have spent a lot of money. You find that we have spent a lot of money in training someone for a period of 6 years at a high cost, at maybe even a government institution, but we can't offer them sufficient reasons to stay and practice in their own country. Okay, so and the demand for these people exists globally, and they will be paid better somewhere else. Other than payment and remuneration, people generally want to be in a place where they feel useful and they feel that their skills are being put to most use. In East Africa and in Africa generally, we have limited access to well-developed labs, basically super specialist hospitals or centers of excellence in different fields. These specialists want to practice in a place where they can provide the best service to patients and have the best outcome, or produce their research and have it utilized in policy and in policy development, having their own research being used in guidelines, development of guidelines in policies, in patient management. So we do not retain our own specialists, and we have a heavy load of brain drain that is limiting our own access to specialists.
So this brings up the issue of brain drain and how it affects neuroscience, neurosurgical care, and also neuroscientific research in our region.
Yeah.
What do you think is a very realistic approach to tackle this?
So we need to have a very intentional. First of all, we have to have a discussion as a region, if we're talking about the East African community, and have an intentional approach to what we're going to do to ensure that we have adequate number of specialists in medicine, in different aspects of medicine or in different aspects of healthcare that can support our growing population. So we need to plan for a longer period of time. Say we want to have this number of specialists in 2030, and we need to ramp up our training to achieve that. And also we need to retain the ones we train. Then we also need to call back whoever we believe is specialized enough in different aspects of neuroscience to come and train them. So it's a long-term plan. It requires a lot of financial investment and support and budgeting that is quite difficult. It requires a lot of prioritization that has been very interesting. It's a very interesting issue when it comes to our national and international practices as a country. That is.
Yes. So how do you envision this study impacting neuroscientific training, guidelines, and especially policy making to benefit the scientists?
So first of all, this research was aimed to first help anyone understand where we are, from the trainee who is trying to see where they can fit, what place they can carve themselves in neuroscience in East Africa, and then for different institutions, different organizations to see what they can do to help. So as an institution ourselves, the EAJNS, we know what role we can play. We can try and bridge the communication barrier across Africa. So what we're trying to do is, again, train more researchers, train them in peer review, in creating proposals, in publishing research, and then also act as a communication or a bridge between African trainees and different universities. So for instance, how can students in Kenya go and study neuroscience in South Africa? So we want those universities to provide that information more freely to students in Africa in general, by providing a platform, basically. The other thing is that we are trying to allow researchers to publish more easily. Basically, they don't have to pay a lot of money to publish. They don't have to pay any money actually to publish their work. They get dependable review process, a dependable editorial process, basically, which is to the quality expected from a world-class journal and expected according to basically standards set globally. For them, then have their work being accessed easily by readers and at a platform that is of good quality. So that is what we as the EAJNS can do. But in general, this paper can inform other organizations now, which are also trying to fill that space. So, for instance, the East African Association of Neurosurgical East African Association of Neurosurgeons, EANS, can act as a bridge among the neurosurgeons. There is an association for African neuroscientists. There's an association for psychiatrists. All those things can be accessed more easily through those organizations.
Yeah. So through your study, which areas in neuroscience do you think urgently need locally generated research?
So due to the current state of basically our population with the rising prevalence of non-communicable diseases, especially non-communicable neurological diseases. So we have a higher rate of patients who are developing strokes. We have the diagnosis and prevalence of epilepsy is growing across sub-Saharan Africa. We are also having more patients developing, actually presenting with neurodegenerative diseases. So in that aspect, if we can train more specialists in this field, from neurosurgeons to neurologists to neuropsychiatrists and occupational therapists who are specialized, physiotherapists and occupational therapists who are specialized in assisting patients with this wide range of conditions, that would improve the outcome of our patients. So it also places the need, it clarifies the need for better support for neurological and neurosurgical care in East Africa for patients, that governments need to now sit down and think about which institutions we can develop, how many doctors we can train so that we can improve the outcome for these patients.
So when you're conducting your study, was there any incident that felt particularly meaningful or eye-opening for you?
The most significant thing through the process of reviewing all the published research that we could access was identifying how far behind we are, especially as East Africans. It's like we're playing not only catch up with the rest of the world, we're playing catch up with the rest of Africa. So if that 30% of neuroscientific publications are coming from South Africa, who are also funding up to 50% of their own research. So up to half of the research is self-funded. That means they're not really dependent on the rest of the world. Compared to us now, who highly depend on international organizations, who are only, as Kenyans, for instance, just producing 2% of published research. It was eye-opening, and seeing that there is a lot of work that needs to be done, and that there is a lot of support that needs to be provided.
So finally, what advice would you give to young researchers who want to do research in neuroscience?
So the first thing is to make use of what's available. We have so many institutions now that can provide training, support, at least exposure to our neuroscientists. So that would mean attending just simple trainings like the peer review programs, attending conferences if possible, especially now that we can have these organizations supporting students in different fields, and also trying to see if students can go across the border and maybe get exposure in different countries. Like, for instance, I remember you had gone to South Africa for some neurosurgical training for a bit. Then you must have realized how different practices are there to us, at least when it comes to access to equipment, diagnostic modalities, and economically, they're not too far ahead of us, at least as East Africans. And so, with exposure, with support for young students, they can fast identify what places what they can do for the different fields, and just interact with other people who are already in such positions, by means of reading their work or seeking mentorship in the fields that they're interested in. That would significantly help them in their future plans.
What policies do you think are very important now that your study has discovered that Africa, especially East Africa, is quite behind compared to not only Africa but the rest of the world? What policies do you think we need to adopt very soon for us to catch up?
Yeah, so as I said, we need to be very intentional about training and research. So that would mean having a national conversation or a generalized East African conversation on what role our governments can play in supporting neuroscientists. And it doesn't have to be direct support to neuroscientists, just building and supporting existing medical research institutions like KEMRI, which almost every country in East Africa has a specific institution where where the main role is to conduct research. If we can just support those institutions, provide adequate funding, provide information, overhead support, management, proper management, and follow up on all those things. Just those simple, it sounds like I'm saying simple. They're not simple, but those acts can support training and output of researchers and the output of research in itself. Then the other thing is to first understand, why do we need neuroscientists? I think the general population does not yet understand who neuroscientists are, what their role is in the population, who is needed in general. So, for instance, you don't really see a neurosurgeon unless you really need to, in a very difficult position, and that means we need to listen to neurosurgeons and neurologists when it comes to making decisions on how we're going to prevent traumatic brain injuries, for instance, from road accidents or from things like that. They need to be involved in policy making in different fields where the patients are coming from. So they have to be involved or consulted when we are trying to see how we can reduce the amount of accidents among motorcyclists, for instance, how we can support our elderly. So all these things are kind of located in different organizations in government, but the government needs to consult them, but also from our own perspective as medical practitioners, as healthcare practitioners, we also need to be more involved in policy development. We need to be there when these decisions are being made. And most of the time, it's not as obvious, but those positions come around and we try and say, no, I have 1,000 patients I need to see, so I'm just going to ignore this. Somebody else will handle it. That won't work. We need to be more forward thinking. What policies can I be involved in that are backed by actual research as a scientist, that basically the things that are replicable, reducible, that can reduce this specific statistic significantly. Just a small amount of action in a specific field can make a lot of difference.
Thank you so much for joining us today, Dr. Nageyle, and for the important work you're doing in research and as the managing editor for the EAJNS. To our listeners, you can explore the full article and also other neuroscience research on our website, theeajns.org. I'm your host, Riya Patel, and we will see you next time.